what I'm going to do real quick is just transpose these onto the answer, or not
Okay.
answer sheet, but the summary.
Okay.
So that we can kind of take a look at it. Now, I talked to you a little bit, this is a screening, right? It's not an
Yes,
evaluation.
you did explain that.
And basically what that means is that it's just a really small sample in these different areas, and they compare the exact same sample to different kids in around her age range. Yeah, and again, it's just gives us a slight indication of how she's functioning in comparison with other children in that age range.
All right.
So. Okay. Now, I don't know, I'm kind of a visual person, so I like this little chart thing. The gray area is if children fall within that area on their scores, then it might be something that we want to take a look at, giving her some extra help with.
Okay.
In the white area, that is what the majority of children her age were able to do.
Okay.
The first one, as you can see, is that the communication is in the gray area. And you had said when we started that you were a little bit
A little bit concerned
concerned.
with her not having words
Right.
and not really wanting to look at books or,
Right.
you know, respond when I read to her.
right,
Yeah.
right.
So-
And yeah, I saw the same thing. So that's pretty well within the gray area. I'm going to come back to that. Let's
Okay.
look at these other ones. Clearly, her gross motor skills are the highest you can
Yep.
get.
Yep, she's pretty mobile.
She is. She's a climber.
Yes.
And then fine motor, well within the age or her developmental range there.
Okay, good.
And problem solving, she's a thinker for
Yes.
sure. And personal social is a little lower. It's not in the gray, but that could have to do with some of that communication too.
Okay.
I think. So, all right. So here's the thing. My first question when I see a low communication score is she hearing us? And what do you think? Are you noticing anything as far as her hearing goes?
Well, I feel like maybe louder sounds she tends to respond to better than quiet sounds. Like if we're whispering, I think maybe she doesn't
Okay.
hear us. I don't know. That's something maybe we could look into a little bit more.
Okay. And that was too that one day when you came in and she hadn't seen you, why I said, call her name. And she did turn.
She did.
But that was a nice loud, and it was nap time, so our environment was quiet, which is rare
Right.
in our room. It's usually not quiet. I tried some with like a little bell and a little squeaky toy. A couple different times on a couple different days too, because I was a little concerned about that. And I noticed that she always turns to one way.
Okay,
So I'm
yeah.
wondering if maybe one side she's not getting complete hearing.
Okay.
When's your next pediatrician appointment?
We actually go next week.
Oh, perfect. Okay. I'm going to give you a copy of this.
Great.
And I would like for you to take it with you to your pediatrician and just ask them, you know, just to check real closely on her ears and ask them. I'm not sure with a child her age as far as a hearing test goes. I know older kids you can go to the health department and get hearing screening there.
Okay.
But with her age, I'm not really sure. So ask the doctor if he thinks, you know, that there's an issue or what have you,
All right.
where you can go for some sort of a hearing screening.
Great.
If you can do that, and then what I'll do is I won't send this form, but we have to do, well, we're asked to do a screening with all the children, and then we report to, it's called Child Find
Okay.
Services. And so when I report that she's fallen below kind of in this communication area and that you're seeing it at home, I'm seeing it at school, and we're both concerned about it, most likely you'll get a call from them.
Okay.
And ask you if you'd like to have an evaluation done.
Okay.
And basically an evaluation is just more in-depth, and they would have a specialist, a speech and language pathologist would do the evaluation
Okay.
just to see if, you know, there's specific areas that she needs to work on or what have you. After that evaluation, they may offer her some services. They may just say she's still within developmental range, let's wait.
Okay.
Or they might give us some activities for you to do at home and meet at school.
Okay.
So that's kind of how that happens.